Well, we've been talking about our hearts all month long, kind of appropriate since February is Heart Month. And our friends at SECOURS have helped us understand the warning signs of heart trouble and even given us some tips on keeping our hearts healthy. So this morning, we have Dr. Patrick Curley here with us to talk about heart imaging technology and how it can detect trouble. Doc, thanks for joining us.
Thank you for having me.
All right, let's talk about some of this technology that you have and how does someone come to even use that?
Well, as a cardiologist, we have a lot of tools that we can use to look at people's hearts, from the more invasive side, the cardiac catheterizations, all the way to non-invasive with ultrasound, cardiac CAT scans, as well as cardiac MRI.
What gets you to there though? Would it be like, oh, I feel like my heart's been skipping a beat, or I just am really worried that something's going to happen down the road and I want to have a kind of a map right now?
Well, really anything in between. I mean, a lot of people can feel, like you said, skip beats, or what we call palpitations, which is in the regular heart rhythm. To the people that just say, hey, you know, I have an aching in my chest that comes on periodically, especially if it comes with activity, that can be specifically worrisome for us.
But normal folks sometimes can still have just a little heart flutter. Is that totally abnormal for most folks?
Not necessarily. If it becomes more frequent, it certainly warrants looking into. Everyone will have extra beats periodically, but if it becomes worrisome to you as a person or a patient, that it certainly should be something you should bring up with your doctor.
Now, looking for plaque buildup in arteries, that's kind of a sign of maybe potential problems down the road, and you can do that with a CAT scan too?
Exactly. So we're fortunate at our SECOURS location that we have an advanced CAT scanner. We can detect calcium buildup in the arteries of the heart as well as elsewhere, and also look at the lumen or the artery itself to see if there's plaque buildup or any kind of narrowing, which could be problematic.
Right.
Because if there's plaque, what does that mean?
Well, it may predispose you to having a heart attack down the line, or if it's just a small amount, certainly something that you can diminish down the line in terms of preventing a heart attack if you get on the right medications.
How do you get the plaque?
The plaque builds up just over time. I mean, things that we have in our genes certainly predispose us to having heart disease or coronary artery disease, but also what we eat. People that smoke tend to have early formation of these plaques, so these are the kind of things that we try to mitigate or decrease in our practice.
Do you still put stents in to widen that passageway for blood?
They do, and especially in an emergency or a classic heart attack where you have that very bad pressure. In a life-threatening emergency, a stent can save your life.
And that is a lifesaver, stents.
Oh gosh, yes. Now, one of the things that you have, it was talking about you can do it in one breath. What are you talking about? Why is that good?
So any kind of testing that you do with a CAT scanner has some radiation risk and exposure to get those pictures that we need. If you can take one breath and take all the pictures within that one breath, then you can diminish the amount of radiation that's applied to the person, which is certainly beneficial down the line.
That's right. When they do take that x-ray, you have to hold your breath.
Exactly.
Is it like a, or is it
just
like
a regular breath,
breath?
hold it in, we watch your heart rhythm, and at a specific time we take our picture, and we get all the information we need in that.
Isn't it funny that whenever someone tells you to hold your breath, you're like, oh gosh, I can't do it. But like on your own, you could probably do it for 30 seconds. What I love is when they say hold your breath and they wait too long to tell you you can breathe again.
That's right. We have to make sure to tell people to go ahead and breathe.
I'm still going, I'm still going. Well, if people are watching at home and they're like, man, I have a history of heart issues in my family, would they be a good candidate to come talk to you? Or?
Absolutely. I mean, if you have a primary care doctor, that's a great place to start. The things that cause heart disease are hypertension, diabetes, smoking, high cholesterol. These are things that are very rampant in our society.
Right.
If any of these risk factors, certainly warrants investigation with either a cardiologist or your primary care physician.
Now, you still doing stress tests, either chemically or the treadmill?
Exactly, and that's a good option for a lot of people. You know, if you've had previous heart disease that has had a stent, you know, a CAT scan is probably not a great option for you. But the traditional stress test with a treadmill or with medications is a great option.
What does that look for? Just to see if you get out of breath more than you should?
Exactly. We can look for EKG changes or changes that suggest that your heart's not getting enough blood when you're exercising. We actually have people exercise on the treadmill in front of us so we can see what brings on their symptoms.
Is it true the single best thing you can do for your health is to quit smoking?
That is huge. I mean, I think all day in the clinic we're telling people that, and there's a lot of resources out there for people that do smoke to try and get away from that, because it will decrease your risk of heart disease.
And to move, just be active, right?
Absolutely. even just 30 minutes of activity a day is something that can really diminish your risk of heart disease down the line. And it doesn't have to start there. You can start with 5 to 10 if you haven't been exercising on a regular basis.
That's great. So you got all the bells and whistles at Bon Secours.
It seems like we have all of it. I mean, we have a lot of options and tools for each people or each person we see in the office, and we can tailor it towards them.
Well, great. We're
I think
like we're in
he's
good
smart.
hands.
I like this
right?
guy.
He's used a lot of big words
He's
today.
a cardiologist.
Yes.
Yeah.
We appreciate you, Dr. Hurley. Thank you so much. And Bon
Thank you.
Secours,
Thank you.
bonsecours.com.
Our question of the day is coming up. What just gets better with age? Can you think of anything?
Hopefully your heart, right?
Yeah, this man can take care of it.